Okay, I got it to work.
Okay.
So, what was your POV Mad Lib?
Let's see. Can I screen share?
Yeah. Actually, I need to pull up something else too.
Okay. So my Mad Lib was parents of potty training age children need a good way to find multiple resources for potty training tips because they have limited time to visit multiple websites and apps, may have limited financial resources available, and feel that this is a skill they should be well informed on before trying options with their children.
Um,
So I kind of came up with this idea because I'm in that stage with my child. We are working on potty training and it is not going so well. um
are you like
so-
having conversations with like other parents or
yeah, so I've reached out to some of my friends that are parents that have already gone through this. And I've also used like social media to post, like asking people that I don't talk to on a regular basis, like that maybe we just connect through Facebook, what their recommendations are.
Mhm.
Um, and honestly, it's been really frustrating because a lot of people just especially on social media, they'll just like share links and be like, check out this blog or check out this $20 book or this $15 product really helped us. And it's like, I don't have an extra $40, $50 to spend that may or may not work for my kid.
And that's
So
just a
it's,
lot of places to be jumping all over the place on the internet. Like you don't have time to be doing that research all the time.
yeah. And so it's like sometimes you just wish it was easier. Or that there was some kind of resource out there that would give you like a better idea of like, yeah, this is actually probably worth your money. If your child is doing these specific things, this will probably really help. Or I don't know, just I guess a larger group of people to provide information would help. I don't know.
I guess like you could get that kind of stuff in like a forum or something. Like people can post like on Facebook or in like forums online. Like you can get all those voices together in like one place.
Right.
So which of the solutions did you like think would work for something like that since it's such like a broad topic?
So I think in like an ideal world, the crowd storm would work. Just because to create a product that would benefit multiple parents, just putting out feelers with a large group of them and asking like, hey, what is your opinion on this? Or like, would you use this type of item? Or just seeing like, would you be more likely to use X over Y if you were looking for this type of information? Or even just confirming that other people are having the same issue to know if it's a path worth traveling, I think would be probably the best outlet initially to like kind of go through and see, just to make sure that you're not going to try to create something and then no one want to use it.
There's I was looking at some of the other ones. Um 'Cause I know you had mentioned like before worst possible idea.
Mm-hmm.
Um because I'm looking at the list on my phone right now. So I'm not like texting or something. But yeah, I think crowdstorming would be best because like you're saying, you're hearing from so many different parents and different people have so many different like techniques to what they want to do that
Mm-hmm.
it can just become like a jumble. So yeah, it says involve the target audience to generate or comment and approve generated ideas. So yeah, you could probably hear from a bunch of different parents and you'll definitely hear one person will probably say what works for them, but then someone else will probably be like, well, that didn't work for me, but here's what worked instead. Um, so that's probably the best way to get all that information in one place at the same time.
I think so too, especially when you're first starting out with getting information or even content for, like whatever solution you go with. Like if you decide I'm going to create an app, like not only can you get feedback on, hey, would you use an app if it was available, but then you can also get feedback on what type of content a parent would want to see on an app or a website or something like that.
Would you want an app like that to have like a one-stop shop for like, oh, it has links to these different websites, it has like references to like books, and then it also has like a forum set up, I guess, to for the parents or different parents to talk about everything? Like, would you just want to have one of those components?
I think personally, like a one-stop shop would make the most sense because, if you're using an app, for example, and you go and you like read all these reviews, and then you have to go on the internet to then look up said product that someone was talking about, like that would just be another extra step that like you have to take additional time out to like go and look it up, versus if it was just linked directly in the app, you could just click it, add to cart and check out kind of thing. um versus having to like open your Amazon app and like search the specific item. um and I mean, I guess too, like if you were to make an app, then there's always like the affiliate links where you can, the designer can get some money from people purchasing items that were
Yeah, it could be
recommended.
like a sponsored thing,
Mm-hmm.
because I know some influencers will have like lists of products that they use, but some do and some don't. But they'll like tell you, oh, this is like a sponsored product, so I may or may not get like a commission if you like click on this.
Yeah,
Um,
especially
so
because like my thought process would be like something like this would, if not free, like very inexpensive for a parent to like download or install, just because usually parents don't have a ton of excess extra money laying around necessarily, especially not if you're buying pull-ups. They're so expensive.
that I've heard that I don't have kids yet. I'm getting there soon, but I've heard that there is a lot of money.
Oh yeah, it's like you go from expensive diapers to expensive throwaway underwear.
I've heard some people talk about like using like wash, like you can wash them or reusable diapers. Like my mom had said that when she had me, she had when I was out, she would use like the regular pull-ups or like Pampers, but then if I was home, she would use like other ones that she could like wash by hand. I don't know how that would work, but like cloth.
Yeah, I know for like babies they make cloth diapers. And then they have like, because my daughter has some, they're called training pants. So they're like thicker than regular underwear, but they don't contain it like a pull-up
Okay.
does. So I mean, you could still have, if they have an accident, you still have something you have to clean up. But I've read a lot about how, like, I guess that using those helps better than pull-ups, just because a pull-up gives them the sense that they're dry, whereas the training pants lets them know that they're not. So,
What actually, like what are some of the things you see online that people recommend?
um, so one of my friends recommended the 3-day method, and I looked into that, and basically you let your kid run around for 3 days without anything on their bottom. And if they go to the bathroom in the middle of the living room, then they learn what it feels like to go to the bathroom on themselves. And normally, I guess that makes them not want to do that again. So you're kind of chasing your kid around for 3 days, cleaning up any bathroom accidents. We tried that. I got in like not even a full day. And I was like, I can't do this.
Oh, actually, hold on. My computer's about to die. Let me get the charger.
Okay.
Yeah, that sounds kind of, yeah, I feel like it's good, but then you have to clean up the mess.
Mm-hmm. Yeah. I don't know. And
Um,
then we've also tried like you can get a special prize if you go in the big girl potty. And that works sometimes. You can give them like a toy or a piece of candy. I've thought about trying, one of my friends did suggest, and I haven't tried it yet, but it's like a sticker chart. And then like after you get so many stickers on your sticker chart, you can go to the dollar store
mhm.
and pick out $1 toy or something like that. But then I just feel like you end up acquiring a lot of junk toys that
Yeah.
your kid wants to play with for 30 minutes and then they don't want to play with it anymore.
And then you kind of just like associate it with like an object where it's like you're
Mhm.
only doing this just to get this thing, not because it's something that you need to learn how to do.
Right. And then like my last hope has been telling her that if she doesn't use the big girl potty, that she won't get to go to big girl school after the summer is over, and all of her friends are going to go to the big girl school. But the first time I told her that, because my kid is a savage, she was like, that's fine. I'll just stay at the baby school.
Wow, she doesn't care. So it doesn't make a difference to her.
No. So I'm kind of hoping though that like, because during like, so she goes to the same preschool for summer camp too. And so I'm kind of hoping, because some of her friends who have already turned 3 and are potty trained are going to start going to like the 3-year-old school.
Mhm.
I'm hoping like when she goes to summer camp and realizes, oh, this friend's not here anymore because she's at the big girl school, or this friend's not here anymore because they went to the big kid school, then maybe she'll be like, oh, like mom wasn't kidding. But we shall see. She starts like summer camp tomorrow. So, but I've seen in like the Facebook group that there's like 3 or 4 people that were in her like class during the school year that are going up to the next level. So maybe she'll notice when she goes, or she might just assume they're on vacation. I don't know. She thinks lots of people go on vacation all the time. I don't know why.
Was there anything else you wanted to like add or like get an idea about for a potty training like tech solution, like, or one of the
I mean, I guess let's go over like your Mad Lib, and then then we can like circle back to like what tech solutions we think would work for each one.
okay.
So I'll stop sharing my screen and you can share yours.
Okay, hold on one second. Let me find this. Okay. Um, okay, so mine is about like women's reproductive health. And my Mad Lib is an adult woman needs to find physicians specializing in women's reproductive health because she's in search of physicians dedicated to her physical and mental health who are easily accessible and give her a positive environment to voice her questions and concerns. So this really came from like a personal standpoint because I've had this problem and I know other people who've had this problem where they go to the doctor and they have like specific questions or they're bringing up like specific symptoms and it's kind of like it's falling on deaf ears. Like the doctor's like, oh, well, X thing is very common in women by this age or like women of color by this age, so you really don't have to worry about it. But in like realistically, in reality, like that's the whole reason I'm coming to you, to be like preventative, to stop X thing from happening, but you're not like giving
Right.
me the resources I need. And then like another part of this is like the maternal death rate, which is really troubling because I kind of feel like when moms have, throughout the pregnancy, everybody's paying attention to the mom and the baby. And then once the baby's born, it's almost like all the attention is focused on the baby and the mom doesn't get much aftercare, like just physically and like psychologically, like in terms of like postpartum depression and different stuff like that. So I feel like that's a big problem. And then for like different, see, I'd highlighted them in a different document here. So just because it's such a broad topic, and I feel like people can approach this from just so many different angles. I had 4, but I feel like I need to just like whittle that down. So I had brainstorm, which is just coming up with ideas and saying stuff.
Right.
Things that come to mind that would like help fill that gap between where women feel like they're not being heard by their doctors. Then I have a mind map, which is you just like make a chart. And I guess it's a more organized way of doing like the brainstorm, where you'll just map it out, put the problem in the middle of the page and kind of branch out. Okay, here's X solution to this. Here's X solution to that. How can I turn this solution into like a tech solution?
Right.
And then body storming, which I feel like would be really good because telling somebody your experience is one thing, but I feel like if people were able to see someone act out like a doctor's visit like that and actually see how the doctor is interacting with a woman who's like expressing her concerns and she's getting like a bunch of pushback, that might have a bigger effect than like just talking about it.
Right.
And then I had like a cover story, which since women's reproductive health is just like a big story right now, I think this is probably a perfect example of that, where you could do like a mock-up of like a magazine cover, like the front of a newspaper talking about like the problem and like the major stories happening within that, quotes from people. All these are cool, but of course I only have to come up to with like one. So I feel like the most practical one would probably be like mind mapping, because I feel like with
Yeah.
brainstorm you can just throw so much information out there, but it's not going to be organized.
Yeah. I think kind of to the way I took it is like mind mapping is like you said, it's like an organized version of brainstorming. And two, like just with as broad as yours is, just kind of having like these different places to mark, oh, here's this. And then this is why I think this branches off of this. Sorry.
That's fine.
Like I just think, and then two, just like having kind of something visually to look at, then it kind of helps you narrow down more, like, because you really want to start really broad, and then it might help you narrow down more like, oh, this is what's really important to me to include in this technology solution that I have.
Mhm.
Or even to come up with like, oh, I want to make sure like this is really important. So like I think it would be better served if I use this like an app or versus a website, because this would fit better in an app than it would on a website.
So with like all of that, I did have an app in mind, but it would kind of be similar to like what you were talking about, like being a one-stop shop for a bunch of resources. So like one of the an app idea could be like you have like it gives you like a database of all the doctors that are in your area that you could possibly go to. um it'll have like whether they're a network or whether they're not, so you would like kind of upload your healthcare information in there, so it wouldn't be as confusing, like that whole chase of somebody does recommend a doctor to you, but then you have to sit there and figure out or make phone calls to figure out if they're a network.
Right.
So I was thinking about that, and then it could have like a forum in there where people talk about all this different stuff. Um, but
Would you want like reviews of the doctors or
yeah,
like, because I think that's important too. Like you might hear from your mom or your aunt, like, this is a really good doctor. And then like they might be really good for the problem that they're needing to be seen for, but they might not actually be good for what you're needing to go in and be seen for. Cause like I just know from like personal experience, like I've had one doctor that was really good when I had a certain problem going on. But then when I got like, when I had my first child, like I didn't have the greatest experience with them. And so I knew when I got pregnant again, like I don't want to use them again
wanted
for
a different doctor.
pregnancy. Yeah. So and I think they're like, I think it would be cool if you had like a rating app for like certain features like bedside manner or um they're really good at explaining stuff in a way that you can understand, or they'll actually order a test that you need,
Yeah.
or
So,
like Yelp but for doctors.
okay. So okay. So I guess depending on like the person using the app, I think maybe there might be like two different people. There might be one type of person who wants like that comprehensive where they can kind of look themselves.
Mm-hmm.
Um, but then like, I feel like there should be like a smaller component where they talk about like reviews and stuff, but it probably wouldn't be on the bigger scale. And then maybe you have another group of people who they do want that like Yelp experience, like like almost like if they're going to a restaurant, but like for a doctor. And
Mm-hmm.
they hear people say, like you were saying, oh, this doctor was really rude to me, or my wait time in the office here was like way too long, or stuff like that. So maybe you could have like the database, and then you could have like the Yelp, the like a Yelp kind of app. But then the third kind, um, for the third component, I mean, I guess the only other thing would be like a website, but I don't know if that would be like linked to one of the other apps, or if it would be for something else. But we didn't really talk about like specifically like what you were gonna.
Yeah, I mean, I could, so like part of me could imagine having like an Alexa skill, for example, because like I know for me, it's really, I guess it's really important to be like consistent. I don't know if that's just a me thing, but like really consistent and like, let's go try to use the potty. Let's go do this or whatever. And I know my daughter personally like loves Alexa when she like plays music, or even if I just ask her questions, like she gets really intrigued by that. So I almost wonder if like that would be an option or an avenue to try, like, because like you can put stuff in your Amazon cart through Alexa. So it's like, if you just kind of have this skill that has like a reminder and maybe other forms of encouragement,
It sounds like it
like,
could be almost like a game for her because it could be
mm-hmm,
like fun.
yeah. And
She'll
then, I mean,
associate potty training with the things that she likes, like Alexa.
right. Yeah. And then like, I mean, just for me personally, an app is always a good go-to because I feel like everyone has a smartphone, and it's just an easy way to have easy access to information. So I don't know, like reviews of products or list of products like we were talking about earlier. And even maybe like a reminder type setting.
Mhm.
And then like I feel like if you built out a website, you could probably get good traction with that too. Um, just so that it include, because you can include a lot more information on a website than you normally can on an app.
Mhm.
So it almost feels like they would go hand in hand, like kind of like a 2-for-1 type thing.
Yeah.
Um, I just really think like seeing reviews and having like easy access to like tips and tricks and products and determining if you really need it or not is the most important, because that's just been the most frustrating thing for me, is just not really having a good place to go to find this information.
And I think people probably prefer hearing advice as opposed to a bunch of links. Cause I know for me, I don't have kids yet, but when I do get to that point, I have the feeling I'm going to be relying like on my mom or my sister or like other female members of my family, because like the articles are fine, but I just feel like sometimes like traditional stuff, like stuff that your parents have been doing all the time. I mean, A,
Mhm.
it's information that's right there, and B, it's just like I guess it's cool to just like connect with your family and understand like, oh, okay, well, this is what you did back in the day, so
Right.
I can apply it here versus like going out and buying like a billion books about it or just like getting overwhelmed with all these links. So I really feel like for you, like a forum would be really good. Just like people sharing what they know from
Oh
person to
yeah,
person.
definitely.
Yeah.
Like some kind of like just like a way to connect with other parents.
Hmm.
Um, I think that's just like really important.
And
And
that's,
then
I think that's
hopefully
good
it's
for
not
the
just full of
user.
people wanting to try trendy stuff.
Yeah. And I think it's good for the user experience, just like for everybody on there is
Mhm.
positive. Okay. So I guess from that, I'd have the two apps and then like the website. I had like another
Would
problem.
the website be like a combination of the two apps, or would you like want it to be?
I kind of wanted to like serve its own separate purpose,
Mhm.
but I don't know because like there's always a website with like a companion app, and I feel like there's a lot of times where there's like redundancies. Like somebody will have something on the website and all they do is just literally slap the same version of it on the app. And I feel like an app should function completely differently from a site. So if I'm going to have like the app that's the database, the app that's for Yelp, then like you to have a website, maybe. I had a situation where I thought it was super convenient where I couldn't make it into the doctor's office, and my previous doctor they didn't offer this, and this is why I switched over. Well, it's not why I switched over, but it was just difficult for me to like get access to them outside of me having an appointment. Like if I had a question, my current doctor like presented me with the option to do like a telehealth visit, and I was like, oh, that's a thing. Like I knew about it, but I'd never had somebody recommend that to me as like an option.
Right.
So because like at the time I wasn't here, I was in Columbus with my mom, and I wouldn't have been able to make it back to Atlanta in time for the appointment that was there. So she said we can just do telehealth, and it was really personal
Uh-huh.
in a way where I mean, like it's always private because you're in the doctor's office and you're in a room by yourself. But like that one-on-one, just talking to her and kind of just having her attention, that was cool. So maybe like a website could be like a portal for like telemedicine or telehealth. Actually, I have a question. What's the difference? Is there like a big difference between telemedicine and telehealth? Because I know you're in like,
No, I mean,
are
for
they
the
just used
most part, it's just kind
interchangeably?
of the name, just depending on what they call it. Um, but I mean, as far as I know, it's all kind of the same thing. It's just a different name for it. Um, because I mean, like, I don't know, because like you can have like telehealth visits with like a nurse or like a nutritionist or a doctor.
Hmm.
So it's not always a doctor that you see. So I don't know if maybe they differentiate that way. Like if you're seeing a doctor versus if you're seeing a different kind of medical professional.
And that would just fall under health versus the doctor being like the medicine.
Right. Because I mean, like, even I know with the pandemic and everything, even like mental health professionals switched over to doing telehealth visits as a way to like still. And I mean, there are some doctors' offices too. I think it was probably more in the mental health sector than in the regular medical type setting. They did like phone visits where it was literally just talking to someone on the phone,
Mhm.
versus doing like a FaceTime or Zoom type call. But it's kind of crazy because to my knowledge, you can still bill it the same way you bill an in-person visit.
Really?
Hmm.
Oh, I was under the impression it would be kind of like cheaper, but
That's what I thought too, but apparently in most instances you can bill the same way because like I know very little about medical coding, but like normally for like office visit levels, so there's like four different office visit levels and it's based on the amount of interaction you have with the healthcare provider, how much time they spend with you, and sometimes even like the number of things that you discuss. Like a physical is always kind of classified under the same level visit,
mhm.
regardless of like how long you spend. Because if it's like a physical, like an insurance company will only allow you to bill so much for an office visit versus like if you go in for a problem visit, it could be anywhere from a level 1 to a level 4, just depending on like how in depth the doctor goes with you. And the higher the level, the more expensive the visit is. But they also require a lot more like charting and documentation to prove that that visit fell under the specific guidelines set for that level visit.
That is involved. Okay, I guess I have to keep that in mind because part of the reason I thought of it was maybe because it was cheaper, but I guess not.
Yeah. And I don't know because like a lot of stuff changed because of the pandemic. Because like initially a lot of insurance companies wouldn't cover televisits before the pandemic, but then when everything shut down, like they didn't have a choice
Mhm.
but to offer that as a service. So I don't know if they made a new code or not specifically for televisits or not.
I'll have to
Because
look.
my assumption would be if your doctor's not seeing you like hands on, then they're not going to meet some of the requirements for those higher level visits. So I don't see how they could bill it that way. But
Yeah,
I don't
and
know.
if they're doing that, and then maybe there's like that's probably a loophole that they shouldn't be doing. Then, if, like you said, if them being in person allows them to add certain codes or like do certain things that could allow them to charge more.
Hmm.
Huh, that's interesting. That's really involved. I'm gonna have to look up
And
more.
it's kind of crazy because some like electronic medical records. So like automatically when you start a visit to simplify things, it's really smart on the medical records company side or whatever. But they like because you have to, like when you call the doctor, you have to tell them like what you're calling, like what you're making an appointment for or whatever. And like based on that, that sets like an automatic like different things that like your doctor has to click through and go over with you, and that prompts the system to generate specific codes to send to the insurance company, and those codes are like how insurance companies verify what
What
doctors
you can
offices
charge.
did. And
Okay.
so like I just know for me working in medical records, sometimes if like an insurance company is needing to verify information about a claim, then they'll request medical records to look at the actual documentation that was done versus just looking at a series of ICD codes.
Ooh, okay. So you're, if I'm gonna like ever make an app about health, I'm gonna have to know a lot about, I mean, not just like the system, but like protecting people's personal information too within those apps.
Oh yeah, HIPAA is very serious. Like we have annual HIPAA compliance training that we have to do. So anyone who has access to private health information or PHI, you have to go through certain training. And I mean, it's
You said
the
that's a
federal government takes it very seriously. Like if you're um like a doctor's office or a hospital that takes Medicare and you get slapped with too many HIPAA violations, they'll revoke your privileges to file Medicare or Medicaid. And I mean, that's a huge percentage of the population that's no longer going to come to your facility because you won't be able to take their insurance. And you can also be fined. I think it's like $5,000 per violation or something like that.
$5,000.
And I think if you do it too much, you can go to jail. Like depending on like what you did with that protected health information. And there are some classifications of health information that's even more protected than others. Like your name and demographic information, like that has a certain level of protectance, but then like say you're tested for HIV or you have mental health things in your record, like that's an even higher level of protection. Because I mean, even working in medical records, there are some records that I don't have the classification to access. Like if we get a request for that, I have to send it to someone else who has a higher classification than I do to access them.
All that is really good to know. So if I'm gonna like keep this, I have to make sure that I know about all these things.
Yeah. I mean, it's really good, like if you think about it. But I mean, like there are other things too that like, because like sometimes it seems like, oh my gosh, like it's like my medical records are so protected, like I can't access them, my doctor can't access them, but like you can even request modifications be done to your medical records. It doesn't mean that they will, but you can request them. Like if you feel that something was documented incorrectly, you can notify the doctor's office or hospital. And like if say your primary care doctor refers you to a specialist, then there is a section in HIPAA that says it's like continuance of care. So that gives your primary care doctor permission to send any records related to what they're referring you to the specialist, and then the specialist to send any like notes related to that issue back to your primary care so that there's no gaps in care.
That's super convenient. That's super convenient because I know
like you don't have to, so that way it prevents the patient from having to fill out a form every single visit and say, hey, please send these records.
Transferred. Yeah. That's
so
good.
they do have things built in for that, but for the most part, your records are pretty protected.
That's
like
when I
if you were to be in a car accident and they thought that you were intoxicated, the police can't even come in and say, is that person intoxicated? Like that's a violation of HIPAA. They have to subpoena your records to get access to that.
Oh, wow.
Unless you give verbal or written consent for them to discuss your test results with the cops.
They can't do that.
Even the police. The only exceptions are like in child abuse cases or like elder abuse where they're like mandated reporters. But like, yeah, if they just come in and I think that person is drunk and that's why they were in a car accident, the doctor can't tell them. Yeah.
I'm going to keep all that in mind for whenever I get to the later stages of this. That sounds like a whole like 3 or 4 months worth of research just to make sure I don't have people's information just like out there floating around on the internet.
Oh, yeah.
Was there anything else that you wanted to add for yours? So yours is the Alexa command, the app, and then you have a website that's like based more or less like a forum.
Yeah, I think those would be my 3 best options to find a solution for that like Mad Lib. And then yours were a database app, a review Yelp type app, and then like a telemedicine appointment type website.
Yeah.
Okay. Cool. All right. I think that covers it.
Okay.
All right.
Thank you.
Thank you.
Bye.
Bye.